Manaka, Namaste, good evening. Welcome back to our show tonight, Fiji Village Straight Talk. I'm Vijay Narayan, and as promised, we have our guest for tonight, the President of the Fiji Medical Association, Dr. Alipate Vakamocea. Thank you very much, Doc, for confirming your participation very early. And we had also invited the Minister for Health, Dr. Ratu Atonio Lalambalavu. We sent a few reminders for him to appear on the show in terms of talking about provision of medical services to you, the people of Fiji. And I received a message from him saying apologies that he cannot attend the show. But the show must go on. And this show is about accountability and transparency. One of the basic needs for any human being is health services. And that's what we will be focusing on today. And we hope that one day, again, not too soon, we have the Minister for Health here answering the questions that matter to you. Thank you again for sending in your questions in relation to, you had very specific questions for Dr. Vakamocea on what the doctors are facing, and definitely I'll be putting them to him and seeking his responses. So, Dr. Vakamocea, what is the Fiji Medical Association's analysis of health services in our country?
Excellent. Okay. So, let's start off with perspective. Perspective is key. So, if you're talking about the health system of Fiji, then you're not just talking about the Ministry of Health. You're also talking about Oceania, you're talking about ASPEN, PSH, Necessary Medical. So, if you're looking at the health system of Fiji, it's both public and private. And I think FMA can proudly say that the health system of Fiji is actually one of the best is the best in the Pacific. So the Pacific, considering all our Pacific Island brothers and sisters, we're a training institution for most of the Pacific, and a lot of the Pacific Island doctors came to Fiji for training. So we've set the bar pretty high. But like I said, perspective is key. So once you look within Fiji, then you start to see that it's very, very different. The kind of healthcare that you receive when you go to a private entity like Oceania or a public-private partnership like ASPEN is very, very different from the kind of care that you receive when you come to, for example, CWM Hospital or Lambasa Hospital. So I guess the issue is, why do we have, what's the difference? And one of the things that we have seen in terms of our analysis of the health system is, obviously the systems and processes that govern private hospitals are a bit different from the ones that govern government hospitals. And this is where everything starts to fall down. It is our belief that it is the systems and processes of government that are not conducive to safe, effective, efficient healthcare. Okay? Now, what's happened in the past couple of years is medicine has developed, a lot has changed. But what hasn't changed is, for example, the way that drugs are procured, the way that medical equipment are procured. So again, it leads to inefficiencies. And in health, inefficiencies cause death. So if we want to address that, that's probably one of the things that we really need to start looking at. It's the systems and processes that govern the health system in Fiji.
We'll talk about processes and systems, of course, that have maybe let us down.
Yep.
And I like your reply in terms of our whole lot of medical services that we provide in the country. Now, let's zoom into the healthcare services in government hospitals and medical centers, because majority of the people rely on those services.
Sure.
What is your analysis on that?
Okay. So that's where, like I said, things start to fall down. So a couple of challenges. Well, if you were to ask me, what are the three things that maybe every doctor has on their mind when they go to sleep every night? So the three biggest challenges within the Ministry of Health would be infrastructure, and this is not in any order. So infrastructure, we've got issues with our hospitals, our health centers, our subdivisional health centers, right up to our nursing stations. We haven't really been taking care of our infrastructure, and if you don't have good infrastructure, you can't be providing safe services to your people. The second one is human resources. This has been covered in the media multiple times. We've got people leaving the health system in droves, coming out of nursing. We've lost a lot of nursing colleagues, and I guess the thing that people don't realize is It's actually the experienced nurses that are going. The junior nurses who haven't really established themselves, they're the ones who are coming and filling the gaps. And so, in effect, it's lowering the standard. And the third one that will probably be keeping most people awake at night would be the consumable supply chain. So these are, when we talk about consumable supply chain, we're referring to things like essential medications, we're referring to things like medical consumables. So, when you go in hospital and you get a cannula, all those sorts of things, and also the biomedical equipment. Those are probably three of the major issues that are affecting health, and some of the things that would be different if you were using a public hospital compared to a private hospital.
So let's talk about those critical areas.
Okay.
And I just shared with you an experience when I went to the CWM emergency at about 1 o'clock in the morning, taking a loved one to the hospital. And what I got was brilliant service, just everything positive in terms of the doctors here. The young doctors did everything right, but it was about the things around them, as you said. And what I was worried about is that we will lose these people if they do not have what they want. Are you getting those kind of comments?
You've hit the nail on the head. We've had multiple visiting teams. In fact, almost every single visiting team that comes from Australia, New Zealand, America, when they come and they see the challenges that our doctors, nurses, and allied health staff are facing, they're shocked. In terms of the caliber of our healthcare workers, our caliber is almost legendary. You take a doctor, a nurse, they'll survive anywhere. The main issues they have is they're not equipped. They're not given they're not supported, basically. They're not supported with the equipment, consumables, and medicines to be able to deliver the kind of healthcare that they want to deliver. And that's the biggest challenge. For example, for doctors, a couple of years ago, the government granted the biggest pay increase for doctors. So their pay is fine, but you still have doctors leave. And so when we ask them, what are you going for? They're like, man, I've had enough. I want to do things. I want to advance. I want to, bring in new processes, new systems that will improve care, but I can't because I don't have the equipment. I don't have the drugs. I'm not supported. So if I'm not supported, I'll take my business somewhere else. And that's what's happening with the nurses as well.
And being a doctor, when you know you've got a patient, you've got a human being in front of you that you need to help, and if these things are not there, how does it feel knowing that you may be letting the patient down?
Yeah, that's an interesting one, and I think a lot of doctors go through this. There have been times when you don't have the basics, so you go out and you buy it yourself, or there are times when you run out of certain equipment and certain drugs, just straight out of your pocket you go and you get it, and after a while it starts to weigh on you. You think about it and you go, man, that's not my job to be doing that. That's someone else's responsibility to make sure that I've got everything I need to be able to do my job properly. And yet, after all, it takes a bit of a toll on you. It leads to things like burnout and all, where the doctors start questioning themselves, why are we doing this, And then, not just doctors, nurses as well, allied health staff. So they get an opportunity to move into private practice, they'll take it. They get an opportunity to go overseas, they'll take it.
How strong is the support group? Because this may be really weighing down mentally as well for the doctors.
Yeah, I tell you, that's not something that we do very well, especially when bad things happen. There have been quite a few instances where we know we didn't have the right drug at the right time, or we didn't have a particular machine working well, and the patient unfortunately had a bad outcome, or they succumbed. There's no real, we don't even have an internal mental health service. We usually just go tap them on the shoulder, say, look, take some time off and then come back and do your work again. Sometimes we do have the ability to refer them to a colleague who's works in the mental health sphere. There's not much support for medical colleagues when they go through traumatic events.
And this may be also some of the push factors why people are leaving?
Absolutely.
Has the ministry been doing something about it?
It's challenging as well for the ministry because that mental health space is probably not where it should be at the moment. We don't have definitely don't have enough specialist psychiatrists to be dealing with, even the public issues, let alone that of the doctors, nurses, and allied health staff.
Do you think the modus operandi of the Ministry of Health needs to change quite urgently?
That's a that's a rhetorical question, because the answer to that is absolutely. So again, the stance of the Fiji Medical Association is this: unless we change the systems and processes of government that apply to the Ministry of Health, nothing's going to change. We're going to continue to be inefficient. And like I said, inefficiency leads to death.
Well, you had a very strong statement out last week where there were issues in relation to the Ministry of Health staff, band F and above. It's in relation to radiology and those other provision of those other services where they were not entitled to overtime and they do not have enough staff to have the time off in lieu system.
Yes.
And because the Ministry of Civil Service came out with a circular and it applied to everyone, what do you have to say about that, knowing that Ministry of Health was also looped into that whole circular?
So, again, one of the reasons why we're saying that we're asking government to relook at the systems of governance, particularly for the Ministry of Health, because we should never have that issue happen again, where a blanket rule is made without considering its impact, particularly to health. But on the other hand, the way that they responded to our, because it wasn't just us, the Fiji Nursing Association came out, a couple of other groups came out and were asking government, hey, what's the story here? We've basically dropped our level of services overnight almost. And the awesome thing is the response from government was very swift. They reversed that and the services were restored.
But a backward step in the first place shouldn't have happened.
Correct.
Because it means lives of the people who are coming to the hospital.
Yeah, absolutely. And that's one of the things so that we never have this mistake again, let's start to think of, if you want to prioritize health, I mean, it's good that you're giving us, $450 million, which is awesome. It's still not what is required. Like when you look at data from WHO, they're saying it should be a particular percentage of GDP. And at the moment, I think we're sitting at around 3%, but WHO recommends 5%. Having said that, it's obvious the government is prioritizing health, but it's more than just prioritizing health in terms of your finances or budgeting. We need to look at the systems and processes differently from all the other ministries, because ours, if we have inefficiency there, it leads to death. It leads to mortality and morbidity. You can have inefficiencies in other places, people don't die. You have inefficiencies in health, people die.
Have there been discussions? I know you are marveling at the quick response time of making the change quickly. And I said that, should have been analytical from the beginning to make sure that it does not happen. The lab technicians, they released a statement last night, and they are saying this change is only for 6 months.
Yes.
Now, it's not, they're questioning, because what if they have a situation that continues beyond that?
Yeah, and again, I can't speak for government because they obviously have their reasons for doing this. We can only assume that they're probably waiting on the new graduates from radiology to join, in the beginning of the financial year or something, and then that might offset the need for the overtime. But, in my opinion, if there's money set aside for overtime, spend it. Because at the end of the financial year, we know for a fact that the Ministry of Health returns money to government, which again adds to the evidence of inefficiencies. So if you're returning money, you may as well use it.
Going back to, do you expect discussions to take place between you, who are the representative of the doctors, of course, and nurses, etc.? Are these meetings held on a regular basis with the Ministry of Health?
I don't think we have a forum yet where all the different associations and societies can come and have an open discussion. I think that's a really good idea. that probably could be something that we could flag with the PS and see how we could work out a way forward.
We start thrashing out issues and see changes.
Yeah. Yeah.
Now there are continuous concerns. People have sent a lot of questions, and some of these questions are from you, and thank you very much for that. Dr. Vakamocea, there are continuous concerns of medicine shortage. And how does this affect efficient healthcare? You said that affects the doctors a lot when they want to treat someone and they know the medicine is not in stock.
Yeah, that's another painful issue. Right? So the issues with medicines, we've had out of stock essential drugs, out of stock critical drugs, basic drugs for years now, and it's unlikely that this is going to change anytime soon. So I guess one of the things that FMA would like to say to the people of Fiji is, look, our budget for the ministry is limited. It is limited. Our ability to spend it on things like medicines is also limited because of the processes that we have to go through. So unless that's fixed, we can't see a time where we will not have issues with out-of-stock drugs. And again, out-of-stock drugs means delay in care. It means that somebody is not receiving the ideal care, and that could cause issues.
And this comes to the point of the purchase of drugs by the Fiji Pharmaceutical and Biomedical Services?
Yes, yes.
The way the system works, that every purchase of medicine that you do, you have to take 3 quotes.
Yes. So because
even if you're buying Panadol now,
correct.
You decide to buy Panadol maybe 6 months down the line?
Yep. So the way the system works, and again, this is somewhere that people who work in the procurement office and Ministry of Economy, they understand this. It's about budgets. Once you go over a certain limit, it has to go to the Fiji Procurement Office with the Ministry of Finance. That's just a government process. So whether we like it or not, if we run out of Panadol, we need 3 quotes. If we run out of amoxicillin, we need 3 quotes. Anything we need, it goes back to government systems and processes. And these things, we know, take time, take months. And that's, again, delays, inefficiencies, people die.
So right now, the doctors, I saw International Women's Association President Judy Compain tweeted about doctors are buying kits for gynecology tests because the patients, definitely, some cannot afford them.
Yeah. So that's been going on for, like I said, a few years now. So we talked about the FPBS ordering of drugs. So now we've moved on to FPBS ordering of consumables. It's the exact same thing. And these consumables are not made in Fiji. So FPBS now has to look outside Fiji and get 3 quotes and make sure that they're quality approved and things like that. So that just adds to the delays. And it's interesting because we may have these issues in the Ministry of Health, but Aspen doesn't have them, or Oceania doesn't have them. Why? Because their systems and processes are designed specifically for efficiency.
Issues here, people have sent messages mainly about blood pressure tablets. They say most of the time they're out of stock, and or they cannot go and buy at the private pharmacies because it is too expensive. Are you seeing this kind of picture emerging based on the supply issue as well?
Yep. So at any one time, the head of FPBS will have a list of all the essential drugs, all the medications and consumables that are out of stock. That list has never changed. The names on the list would change, but the length has remained the same. So we will always have these issues until we've got some solid commitment to changing the way that we do ordering, especially for drugs, medicines, consumables, and biomedical equipment. Unless that changes, we're going to walk down this path next year, and the year after that, and the year after that.
Has there been any talk of changing it?
Lots of talk, Vijay. But like we say, Kalibat.
No action. You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We'll be back after this.
Yeah.
am I?
Oh, you died, bro.
I'm dead? But why?
Got it, that's what happens when you change your playlist when you're driving?
Crashed.
What? No, this can't be happening. I had so much left to do in life. All I do is stare at my phone because you know I'm Gen Z and we're all anti-social.
Aw.
And I wish I did so
Poor guy.
much, but... By the way, do you guys have Wi-Fi up here?
This is why you should have listened to F96 Drive. Shouldn't let them play the music.
And you just drive.
No! I can't believe this is happening. It wasn't
When you're
even
done,
my
eh?
car and I didn't have
Hell is
car
that way,
insurance.
eh? Eh?
Wait, what?
20 years ago, we had a major drug bust, and you would remember, you would have been part of the operations at Laudala Beach. A lot of people in Fiji did not know what was methamphetamine. And what we are picking up on, people are saying it's readily available. Just the issue in relation to General Secretary, was that a tactical move that he ejected himself from Parliament?
Personally, it's unfortunate.
How are you dealing with those police officers who may be allegedly involved in this?
Vijay, no one is above the law.
We assure you that we will be having police officers around.
As a result of that bad policy, by the end of this month, we would have lost close to about $70 million in government revenue.
Bula Vinaka, I am Vijay Narayan. This is Fiji Village Straight Talk.
Fiji Village Straight Talk with Vijay Narayan. Watch it live on the Fiji Village Facebook page and YouTube channel.
क्या आप भी परेशान हैं?
अच्छी करता है यार, तुम लोग समझ में नहीं आए। अंधार में रहेगा, कट जाएगा जगह, कौन जाएगा भरी? जाएगा भरो।
क्या आपकी भी लाइफ में ऐसी ही टेंशन है? आपकी परेशानी को कम करने के लिए आ रहा हूँ मैं बहुत ही जल्द आपको हंसाने के लिए। रेडियो सरगम और रेडियो सरगम फेसबुक पेज पर बहुत ही जल्द वहीं पर मिलेंगे। हेलो, अरे यार,
Back, you're watching Fiji Village Straight Talk. I'm Vijay Narayan. Our guest tonight, the President of the Fiji Medical Association, Dr. Alipate Vakamocea. Dr. Vakamocea, how are doctors getting affected by the doctors and nurses leaving in droves?
Yeah, so that's a good question. Lots of ways. One of the things that I think is less tangible that we want to highlight is the fact that it affects morale. Especially when like for example in the nursing in some very high risk areas, like you have wards and you have some critical parts of the wards where you need at least like nursing ratios of like 1:2 or 1:4, 1 nurse to 4 patients, and instead of having those ratios we have like 1:10. And so for example a doctor will come and make an order and then come back a couple of hours later to check on a very critical patient and the order hasn't been carried out, and then when you ask the nurse what's up, and she goes, I've got 10,000 things to do, I can't do it. It really starts to affect morale because for the health staff they realize that this is something that should have been done, but because of the lack of HR we can't do it and it's affecting the patient. It really really lowers your morale, and it leads to other things that we can't really quantify much, like burnout and things like that, and not just for doctors and nurses but also the allied health staff. And when you live in that environment for quite some time, eventually you're happy to leave. Any opportunity you get, you leave it. And that's one of the reasons why we've seen a lot of our nurses leave, a lot of our senior nurses leave, a lot of our allied health staff leave. It's because of those situations.
It seems like this HR issue, if it's not handled properly, we are already in a crisis mode.
Yes.
With nurses and doctors trying to just provide whatever service they can.
Yeah.
And there's still been no discussion with the medical association regarding this, how to look for solutions.
So, like if you were to separate out doctors from nurses, just for this discussion, the number of doctors actually leaving Fiji has slowly stopped, especially since the time when we had our pay increase. So if they are leaving the Ministry of Health and going into private practice in Fiji. So technically we're still keeping them. The issue really is with our nurses. They are going and they are gone. They go to Australia, New Zealand.
But it still affects the doctors when you do
it
not have
affects
enough
the
nurses.
Exactly. Yes. They are the core. They're the backbone of the health system.
As you said, you tell them to carry out an order, and they don't because of time constraints or staffing constraints. You have issues.
Yes.
Now let's talk about the state of our hospitals like CWM and the challenges for the doctors.
Yep.
What's the feedback from the doctors at the largest hospital in Fiji?
So we refer to CWM as the old lady. She just celebrated her 100th year birthday. So she's moving on in her age, and she's already gone past her probably expiry date. But the good thing is the government has addressed this, and along with our partners from Australian Aid, they've come up with a plan. So that's where the CWM master plan comes in. So they'll be looking at probably a new sister to CWM in the next couple of years, and then supporting CWM in the meantime, waiting for the sister to be born.
Looking forward to the sister to be born very early, Doc, because of what we are facing in terms of that. And we thank the donor partners for that. We know that work is already underway. Issues being raised by people, one of them was the superbugs that have been detected at CWM, and questions being raised about all levels of ICU, pediatric, neonatal and adults multiple times in a year. And people have caught these super drugs while being admitted, and some have even died. If this was a private facility, it would have been closed as a danger to the community. If it was a restaurant, it would be closed because of unhygienic practices. What is the assessment of this hospital continuing with many cases of superbugs?
It's the only one we have.
No other option.
We have no other option. So we have to live with her. We live with these multi-drug resistant organisms. So the best thing we could do right now is make sure that our IPC practices are up to standard. So IPC is infection prevention and control. So the couple of things, basic hand hygiene, and I guess the public has a huge part to play here as well, because these bugs are actually spread through contact. The person who sent that question in sounds like somebody who understands very well the issues and the wards affected at CWM. So if you are entering CWM and you're going to the into intensive care, you need to be careful of what you're touching. Make sure that you wash your hands. There's alcohol hand gels available at entry points all around ICU. Make sure you got good hand hygiene, because this bug is spread through contact. So if you're touching surfaces, you could spread it to patients, and you could take it home with you. So it's in ICU, it's in acute surgical, acute medical, so all the acute wards at CWM. And from time to time, it appears in pediatrics and a couple of other wards. So if you are entering CWM, be very, very careful about where you're putting your hands, making sure that you're doing hand hygiene, where you're sitting, all those things. Go home, wash your clothes, sun them out nicely, and you shouldn't have a problem. But just be mindful that this bacteria is probably here to stay until we can do some serious renovations at CWM.
You cannot close the hospital down, as you said.
We cannot close the hospital.
Serious services. Now, let's talk about NCDs. The country is battling with this, and a lot of doctors who have been on this show dealing with different types of non-communicable diseases, they confirm the cases are spiraling out of control. And definitely this is affecting the doctors as well, the number of cases coming in.
So to understand the issues with NCDs, because again, we don't have anything positive to say. In fact, we're going to warn again that this is going to continue. And a lot of it is also linked to the disparities with HR. So we used to have something called public health nursing, for example. So public health nursing is basically looking at the preventative side. Because NCDs, once you've got it, it's game over. You now become curative. So the best way to stop an NCD is preventing it. And the late Dr. Tukana would give an analogy about the cliff. So you got kids playing at the top of the cliff, and then they fall and they get hurt, and the ambulance picks them up. So curative medicine is the ambulance. Preventative medicine, that's our public health nurses, for example. Now what we know is because of the HR shortage, the public health nurses who are supposed to be doing the preventative medicine have been brought in to do the curative one. So they've, instead of stopping people from getting NCDs, they're coming down and they're entering our health centers and hospitals because that's where the urgency is. So they've been redirected. And so we've sort of started to neglect the public health, the prevention part of public health. And that's definitely one of the factors that will contribute to NCDs continuing.
And this is where the more campaigns may be needed in terms of how we can not have more cases of NCDs?
Yes. And something else that we talk about in governance is making the easy choice, making the healthy choice the easy choice. And again, this is lots of things that Dr. Tukana used to harp on about. But there are some areas where government can start to help. And one of the areas is, so when you talk about non-communicable diseases, you have risk factors, yeah? So some of them you can change, and some of them you can't change. So the ones that you can change, on the top of that list is tobacco. And we need our government to start adhering to, it signed a convention called the FTCT. It's basically a convention on tobacco control. They signed the convention, but they're not adhering to it. And the parts of there's certain articles of the convention that they're not adhering to are the parts where they go and they actively engage with the tobacco industry. So when government starts to engage with the tobacco industry, people are sitting back going, oh, it must be a good thing then. And obviously that's not a risk factor that they're going to change.
Diabetes.
Yep.
You see a lot of cases, amputations.
Yep.
Young men and women,
Yep.
even now going to very young ages where people are losing their limbs. Amputation has become one of the things that is the answer. And you see more people walking around with walking sticks or on wheelchairs. How is it also affecting other services, because you have more cases of these? We are being told that now a lot more surgeries relating to diabetes have to be done, and others are in the waiting list. What are you seeing at the hospital level?
The feedback that we're getting from our surgeons is exactly what you've said. We call them septic lists, because usually when a diabetic person comes into hospital, if he needs an amputation, he's already quite sick. So they're septic. They need antibiotics. They need removal of the source control. So source control is when we start cutting. The septic lists for our operation theaters can go into the evening. That's just the doctors working on that. And then to make matters worse, so from there they go into the wards and then they pick up a superbug. So it's definitely weighing very heavy on the health system, and it's consuming a lot of our resources, especially in terms of our tertiary care and everything that CWM does. So yeah, it is a dragon, and there's nothing that we have that at the moment is addressing the core issues with
Let's
diabetes.
talk about prevention for diabetes then. You can talk about the dragon. Let's talk about maybe how we can avoid the dragon from going bigger than what it is at the moment.
Yeah, and that's where we really need our public health team to be well resourced in terms of human resources and everything, and then our wellness center. We noticed that the government split the budget for wellness and what is it? Can't remember what the other one was, but family health. So they split the budget for wellness and family health, but we noticed that they removed quite a lot of services that deal with public health awareness and things like that. So again, we need to prioritize it. Only when we prioritize it, then we can start doing the preventative stuff better.
Cardiovascular diseases, this is another issue. Why are we still, questions are being asked, why are we still not having heart surgeries done at public hospitals? Why are we still waiting for visiting surgeons? And what do we need to do?
Okay, so I'm assuming you're talking about open heart surgeries. Yeah. All right, so open heart surgeries, that's like a specialty within the surgical specialty. That's it's not just about the surgeon. They need to have lots of other equipment, backup stuff, post-op care, physiotherapy. Right now we are struggling with the basic services. I don't think we'll be able to have something like open heart surgery available in government service. We have a bit of the cabbage services and the, what do you call those things? I forgot the name, but yeah, cabbage services available. I think Aspen Mayot does some of it. Oceania from time to time does it. But the open heart stuff for government hospitals, not anytime soon.
We have one hospital, thanks to the Indian government, that will be built in Nasinu. That will have
most likely they will be doing the open heart stuff there. Yeah.
The questions also that have come in asking, have new positions for doctors and allied health professionals been created in the last 5 years, looking at how the demand for healthcare professionals is always increasing?
Yeah, I think the answer to that is no. I don't think the Ministry of Civil Service have created any new positions. And in fact, it is one of the issues on our plate with our doctors. They're saying that they're getting they're completing their masters and all of that, but because there's no consultant position, they remain at that level. So they're overqualified for the level that they are, and they're providing services to a consultant level. So we don't have the senior positions. Yeah.
Now, looking at, you did talk about infrastructure, you talked about the HR issues, and you talked about medicine. All of this, based on what we're hearing so far from you, Doc, you know straight away where the issues lie and what needs to be done. And are there attempts being made to have formal discussions taking place? Because as a country, as you said rightly, you don't have positive things to say because most of these things you don't have solutions as yet. Do we expect people to be at the table looking for solutions?
Excellent question. So one of the things that we saw this government do when they came in to office recently was they held the symposiums. I think we had a summit, sorry. We had an economic summit, right? And then an education one. I think it's time that we have a health summit as well, and we get all the stakeholders at the table and we get these discussions going, where we can prioritize the issues that need to be prioritized and come up with valid solutions for them.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We'll be back after this break.
आप देख रहे हैं इसी संडास जो हमारे सुपरस्टार ब्रश अभी आकर इस्तेमाल करेगा किसी वक्त अभी लो आ गया सुपरस्टार ब्रश
Not following me
again. Sir, जनता जानना चाहते हैं सर अगर जनता जानना चाहते हैं सर अगर rumors true sir. Hopefully. Bye. Sir, एक सवाल अब देख रहे हैं डॉक्टर के स्टूडियो में हम भर चुके हैं जेसिका जी जेसिका जनता जानना चाहते हैं जेसिका जनता जानना चाहते हैं कि आप कौन सी मेकअप लगाते हैं
आज मैंने तो कोई मेकअप नहीं लगाया
लगता है लगा ले
How dare you DEA
तो आप देख रहे हैं यहाँ एसएन का गाड़ी पड़ा है काफी गर्जी है लेकिन एसएन साहब एसएन सर अमेरिका से आए हुए हैं सर अमेरिका का जनता जानना चाहते हैं सर आप हमेशा काला चश्मा क्यों पहनते हैं सर
तो सफेद चश्मा कहाँ मिली सफेद चश्मा देखा कहीं तुम
तुकता क्या को है
Oh my gosh! Oh, what's in the box?
You're probably wondering, what's in the box? Well, if you must know, it's actually me. Before you call the police, I'm actually an app. The all-new Fiji Village app. Here's an update. See what I did there? I gave you an update. What's new? Well, for starters, I look different. My new layout also comes with stories if you're looking for something short and sweet. I will bring you the latest news on the dot so you stay updated. You're welcome. You don't have to go anywhere for content because I bring the content to you. Not only can you listen to your favorite radio stations, you can also watch online video content. Which reminds me, do you love sports? Well, guess what? With the Fiji Village app, you can stay up to date with your favorite sports and scoreboards, no matter where you are. Your #1 news website just got better with an app. download and
Demis. Sa mama na lima? Ebe kenapa ya? Gol. Wow.
Back, you're watching Fiji Village Straight Talk. I'm Vijay Narayan. Our guest tonight is the President of the Fiji Medical Association, Dr. Alipate Vakamocea. We did invite the Minister for Health, Dr. Ratu Antonio Lalambalavu, and following a few queries, he came back and apologized that he will not be attending the show tonight. And we expect him, hopefully, to come to a show not too long in the future, because these are serious matters of concern that are coming up. Our medical association president is at the table raising concerns as far as the doctors are concerned. Definitely we need answers. And we go to the next issue, Doc. In relation to drugs, it has been labeled as a national security concern already by the Minister for Home Affairs and also the Commander of the Republic of Fiji Military Forces. Drugs now, we're getting reports every day, green or white drugs are being found by police. These are based on reported cases. The numbers, the percentage of cases increasing. People are shooting up publicly. There's sharing of needles. We'll talk about that too, the challenges with that. Bluetoothing, that term is coming up a lot. But let's talk about St. Giles Hospital first. A medical facility that is there for many, many years as a psychiatric hospital. And now with the new emerging challenges where they're also flooded, bursting at the seams, also handling drugs cases. What's happening at that hospital?
So it's already known that the challenges that St. Giles is having. I mean, it's infrastructure, it's overflowing patients, and if you talk to them, they'll tell you their patients are getting younger and younger, and they're coming in with already high on drugs and things like that. One of the things that we have seen and we're finding a bit puzzling is when you look at the budget allocation for St. Giles Hospital. Remember, this is our only mental health hospital in the country. What we found interesting was in the 2023-2024 budget, we noticed that they had a reduction in basic operations. So electricity, food, that sort of stuff, and that didn't make sense to us because this is a hospital that's bursting at its seams, yet was being defunded, and we still don't really understand why. What we are worried about is, and don't get me wrong, HIV is definitely something to be concerned about, the rise in HIV cases. But I think we need to be careful because we're linking a lot of the spikes in HIV to the drug crisis. But I think we just need to take a step back and just think about it a little bit more systematically and prioritize. When you have a drug crisis, the first issue to be affected will be mental health. Definitely HIV, but mental health. And the other reason why we are highlighting mental health is because if you have HIV, there's drugs to treat it. If you are addicted to meth in Fiji, you're on your own. We have nothing. So we need to start really, not just talking about it, but doing something about our ways to address addicts. Because if we don't do that, Fiji is going to turn into the next Chicago.
The issue is, and that's quite scary, the issue is that we are there already. We're bursting at the seams in terms of patients coming in, a mental health hospital trying to deal with it. We don't have an established drug rehab center.
Correct.
How dangerous is that when we don't have a drug rehab center now and we're getting cases of meth, drugs every day?
Yeah, exactly. So we'll be getting, the way we're going right now, we're going to have drug users with HIV who are being treated, but they'll end up at St. Giles with a mental health issue which can't be treated. And like you said, the button for emergency has already been pressed, but it's now time to start doing stuff. And I think there was some discussion about someone who set up a rehab center in the West
In
or something.
Lotoka, they were here last week, yeah.
Oh, they were.
But they need, again, help from the government, and they do have a 20-acre piece of land and a facility to start off with, but they need, again, and I think they're having discussions, maybe the Medical Association can also have discussions with them, because this is quite urgent. How urgently do we need a drug rehab center that is with full capacity working?
Oh, that's easy. We needed it yesterday. Because, like we're going to start to have an increase in crimes that don't make sense. And usually those patients are going to end up at CWM, and then they're going to pick up a superbug, and then they're going to be delayed in theatre, and they're going to end up with bad outcomes. So it's just going to contribute and just make things even more challenging. So we know the issue, it's time to fix it.
And there are more overdose cases now, a lot of cases, even street kids, the latest statistics that came out, the number of street kids dying because of overdose. So this story is already emerging. It's not a pretty picture, but what also concerns me, Doc, is this the budget for St. Giles Hospital also being reduced. Are you trying to make sense of that?
Yeah, so the two things that we saw that were reduced in the budget were mental health, and also there's a budget that sits with wellness around, I think it's mental health advocacy. So this is the whole preventative part, and that was also defunded. And again, it's not really making much sense to us. And it's something that we'd ask the government to maybe relook at in the next budget cycle. A hospital like St. Giles particularly needs to be supported. Definitely needs to be supported.
And the facility is quite run down as well?
The facility is very run down. There have been some attempts by certain donor partners and other stakeholders to try and improve a bit of that. But you're putting a band-aid solution on a flood basically. It needs a lot more assistance.
You will be definitely making some submissions to government, raising concerns.
Especially around the time of the budget submissions.
HIV cases, we talked about that. It's on the rise with all the different trends that are coming in. And again, you did talk about prevention. We don't see a lot of issues in terms of prevention and how we can do it better in terms of reach and frequency in getting the messages out. Do you think we are lacking in these areas and we are trying to catch up now?
I think so. And again, this comes back to that whole, the reduction in the preventative part of it. But I think, there's a lot of work because there's a lot of stakeholders working in the HIV arena. I think what needs to change is some of the laws surrounding HIV. Some of that needs to be relaxed, and we might even need to start considering a screening program for HIV. And they do it in many other countries where it's anonymous. So they've designed it in such a way where you can go and get tested, and nobody else knows like who you are, but the numbers get fed back. And those are systems, systems and processes that we can improve, because I think knowing that you are HIV positive would then get you to start making changes to the way you live your lifestyle, and hopefully start to go and get medical assistance.
Issue about drugs, going back to drugs, there was a big call in terms of we need to ensure that there's enough deterrence in place in terms of making maybe compulsory testing of drugs before people start at workplaces, or before LTA has come out strongly because they know that some PSV drivers have been taking drugs and driving the public service vehicle, so they're making the test compulsory.
And
what are your thoughts?
Yeah, 100%. I think that's a really good stance. And in fact, it will look really, really nice if government, makes some legislative changes to say something like, in Fijian we have this saying, it says, government is jumping up and down saying, let's do something about the drugs issue. Why not they make testing compulsory for civil servants? Start with us first, us government, and then you move out and start calling out members of the public. But in order to do that, we need a lot of legislation to change, and we need to, more importantly, have the testing available, because the testing for things like meth is a bit complex. Certain things can only, I think, like a urine test can only measure to a couple of days, and then you have things like hair follicle tests that I think like a month or so. So the testing too is a bit of a complex issue, but unless you've got testing, then you can't prove use. So yeah, those are some of the suggestions that we probably have.
There's people saying here that a good deterrent would be people to get tested before they get into a work environment.
Yeah.
And regular testing.
I mean, if you're serious about it. Yeah.
Well, let's see if the government will take up that issue, as you're saying that this is an important one for government. Let's talk about funding.
Yeah.
It's easy to say, okay, government doesn't have money.
Yeah.
It's easy to say, well, Fiji doesn't have enough money, so what you see is what you'll get.
Yeah. Okay.
What's the solution to that?
So Fiji is a unique country where health is a right. It's a right. But if you travel around the world, you realize that it's not the same there. And I think it's one of the things that the public needs to be made aware of, that healthcare and the kind of standard that we want, the kind of standard that we deserve, is not cheap. And you can't blame government for everything. At some point, the onus comes to the person. Like healthcare should be everybody's responsibility, not just government. So one of the things that we've been seriously thinking about, and we've discussed this quite a lot, but we haven't really found a forum to raise it, is possibly the issue of a health tax. And if you want to be inclusive, you look at the priority of government, it's always health and education. So maybe a health and education tax, and that might help offset some of the financial constraints of the Ministry of Health. And then let's see whether that deters people from certain activities that might get them sick.
And make sure that the health tax that is collected goes to the ministry.
Oh yeah, that's key, please. Yes. Not into the government general coffers, but goes directly to the Ministry of Health for them to be able to improve their services.
Working conditions of nurses and doctors, we talked about that.
Yep.
What is your message to government on staff retention?
Yeah. You got to make the grass greener on this side, and it's not difficult. If you give the healthcare workers the tools that they need to carry out their services, they'll stay, number one. Number two, so doctors' pay, I think we've got that pretty much sorted, but FMA would like to raise the issue of the other allied health, because the nurses you don't mess with the nurses, they're sorting their payout. But we also want to raise the concern from our other allied health staff, the labs, the radiographers, the pharmacists, the physiotherapists. We would like to ask government to do something called a job evaluation exercise, to have a look at what their salary is now and maybe make it more appropriate. And I'll give you a classic example. The head of department of pharmacy. So pharmacy, you go to school for 5 years, you come out. The head of department, obviously an experienced clinician, would get paid something around $40,000. Yeah? And this is the head of his department. Whereas on the other hand, you have an intern who's completed 6 years of medical school, coming into CWM as an intern, who gets paid more than the head of pharmacy. How does that make sense? It doesn't.
Definitely needs a review.
Needs a review. So the review needs to be done for all allied health cadres, because the thing is, if you raise the standard of the allied health cadre, it makes our work easier. So it's a sort of selfish but not selfish reason.
Well, you need to get the best service out there, and
Yeah.
if the doctors need it,
Yeah.
we need to ensure that is done. So hopefully, again, you have said that these discussions are important to take place yesterday.
Yeah.
So hopefully it takes place as soon as possible. Now, what does the FMA see as priorities that need to be addressed for positive changes?
We need to fix the issue of our nurses leaving. I think, again, they are the backbone of the health system, and I'm not just saying this lightly. If we, and like I said, the ones that are leaving are the experienced ones. If the younger ones could leave, set, but it's the experienced ones that are leaving. And when they leave, it automatically, overnight, it lowers the health standard. So we need to work with our nurses, with the Fiji Nursing Association, the Fiji Nursing Council, to look at ways in which we can address those gaps. Now, we've made some suggestions, and some of them lie along the lines of, like right now we're short of nurses, so if we just get them to focus on the clinical activities, like giving out of medications, taking blood pressures, then all the other responsibilities that used to be nursing, we can hand off to a different cadre. We've got Australian standard, what is it called? Healthcare providers, what is it called? We've got other cadres that can fill the gap to do things like, help make patients' beds, take them down to the scan room, that sort of thing, so that we free up the nurses just to focus on the clinical aspects. Can't remember what the other group of people are. Caregivers, that's right. We've got a certificate that's recognized in Australia for caregivers. They can come into our hospitals and provide, the level of care.
And free up the nurses.
And free up the nurses to do the clinical stuff. I mean, those are some of the, I guess, practical solutions, because getting new nurses trained and pumping them in is going to fill the positions, but it's not going to fill the issue of the experience, because we want our experience, we need our experienced nurses to stay.
Doc, before we finish off, what's your message to the people of Fiji?
I think the government has shown that they are willing to work with us, which is awesome. I guess our message to the people of Fiji is, in order to improve the health standard of Fiji, we need to work together. So people need to start taking better care of their health. When they come into hospital and they're admitted and they're asked to buy medications or basic consumables, please don't get angry. We want to work with the Ministry of Health to be able to provide the service. But at the same time, we want government to look at the Ministry of Health in a different lens, to try and make the processes and systems more efficient, to reduce the delays, to improve efficiency so that we have better patient outcomes.
And that's the show for tonight. The President of the Fiji Medical Association, Dr. Alipate Vakamocea, thank you for coming forward and talking straight on the show. And also, as I said, that we really need to get the Ministry of Health on the show as well, talking about issues that matter, and we greatly appreciate your responses, the questions that were put forward also from the people of Fiji this evening. Until next week, have a great evening.
Okay.